The opinions expressed in the following program are not necessarily those of Eastlink Community TV, its sponsors, or partners.
Good morning, folks. I'm Mayor Mike Savage, and I'm pleased to be here, like the rest of you, because I'm afraid of what MF would do if I didn't show up. It is awesome to be here. Good morning, bonjour à tous, Grain Jalasi. Before beginning, allow me to acknowledge that we are in Mi'kma'ki, the ancestral, the unsurrendered land of the Mi'kmaq people here in Jabuktuk, known. And if you don't know what Jabuktuk means, go out to a window and look at the harbor. It means the Great Harbor. We also acknowledge people of African descent who've shared these lands for 400 years. Over 50 strong and resourceful African Nova Scotia communities exist today. So I want to thank you all for being here and supporting the North End Community Health Clinic on this beautiful morning, just 2 days before the organization's actual 50th anniversary date. Now, one of the things I like most about being mayor, and there's less and less of them, I must say, is having the opportunity to work with organizations that's not true, that truly make a difference for the people of HRM, and particularly for people who need a little bit of a hand up. So, this is one of those, a real trailblazer in providing equitable health to communities in a dignified and a supportive way. Later this morning, you will learn more from the health heroes who were there at the very start of this organization. And then I will have the awesome pleasure to talk with those that work now at the center as they share what they do every day. So these past and present health heroes have truly made and continue to make a mark in providing care to those in need. So thank you for being here today. I look forward to speaking with you after breakfast, and I'll ask MF to come up, Marie-France Leblanc, to say a few words. So welcome.
Good morning. Thank you all for being here so early. I've been joking that those of you that are in the construction industry were sitting outside at 6:30 waiting for us to start serving the coffee. So thank you for being here so bright and early. I am an MF, as the mayor has mentioned. For those of you who don't know me, my name is Marie-France Leblanc, and I'm the Executive Director of the North End Community Health Center. We are so pleased that you were able to join us today, and I'm really looking forward to telling you what we've been up to in the last 2 years. Some of you have been here before, but many of you have some new there's a lot of new faces here, so we're very excited to tell you a little bit about ourselves and what we're up to. COVID-19 certainly has thrown a wrench into what we do. The team, many of them who are here today, really stepped up to the occasion to support our community when COVID-19 hit. We really didn't miss a beat. They were nimble, they were creative, and they ensured the continuity of care for all of our community. The nurses, doctors, and social workers worked in small teams, rotating through both of our locations, both on Gottingen Street and our new location on Albro Lake Road in Dartmouth. Housing support workers, intensive care workers, and outreach medical teams embraced PPE, and I say that, embraced it, and the outdoor spaces so that they could continue to provide critical care that was needed. We added a lot of new services. We added harm reduction supports, including an emergency managed alcohol program, which we'll hear about a little bit later. We supported testing of the shelters. We supported vaccination clinics. We supported isolation sites, as well as providing mobile clinics all throughout HRM. Also over this time, we really had to step up our housing support systems. We took over the management of the old International Hostel on Barrington Street in order to provide additional support. We took over another building with another 30 units in it to provide people who were in need of full support. RHI, which is the Rapid Housing Initiative, we were the lucky recipients of a grant, so we're in the middle of renovating a building in order to provide new housing for African Nova Scotians in our community. As well, we are involved in a new project, which I'm not really supposed to talk about, which will provide another 60 units. It's been all over the news, but we're still not talking about it. So we're really excited. Everything we do is done through the lens of healthcare, support, meeting people where they are, and providing sort of wraparound services. I'm excited that you're going to hear all about it from the people that actually do the work. I tend to sit in an office, but they do all the hard work. So they're going to tell you all about what we do and how we do it. We're grateful to everybody who supported us during the pandemic. We were amazed at how everybody stepped up. And we're also thankful for all of you to be here today in order to help us celebrate our 50th anniversary. We're especially thankful to Eastlink, our presenting sponsor, who not only is here sitting at the table, they came to the table and they're sitting at the table, but also for filming this and sharing our story across their channels. So we're very excited about that. We'd like to thank our Health Hero sponsor, Rockhead McFarland's. And a big thank you to our excellence sponsor, to our major sponsors, and to our community sponsors. There's too many of them for me to name right now, but if you look, there's a program there, so please take a look and see all the wonderful people that have supported us. We're also going to be running it through the slides with some very wonderful pictures. Some of those people are here today that have been there. They're looking a little younger. Some have hair. I'm looking at you, John. He's not even listening to me. Anyway, so I think you're all getting hungry. So I'm going to call up Rose Fraser, who is our own personal health hero. Rose retired during COVID, but was with the clinic for 35 plus years, I believe. And she's going to do the blessing, and then we'll come back up after breakfast.
Good morning, everyone. I don't even feel like I'm retired. I feel like I'm still working. As was already acknowledged by the mayor, we are in the ancestral territory of the Mi'kma'ki people. And many of my ancestors were connected with the Mi'kmaq people. They helped so much in our community, the community that I'm from, North Preston. And I'm here standing on the shoulders of those who helped us. So at this time, I'm just going to lead us in a blessing. Lord, the giver of life, creator, advocate, and my Savior, we thank you for the hands that have provided and prepared this meal to nourish us today. Let us be mindful of those who don't have the privilege of food and shelter. May we not take our privilege for granted, but be willing to open our hearts and our hands to the people that we serve with compassion and care. Let us serve one another. We pray these things in Jesus' name. Amen.
The clinic was started by 3 women in the community who felt very strongly that the community needed to have access to medical care. People viewed it as a sort of interesting place, but there was no sense of how important it really was until much, much later, when people began to see that there was an impact. The North End Health Centre was, if not the first, among the first groups to take this collaborative approach.
It started really in response to a lack of service in the North End, lack of medical service, and in fact, it is a true community health centre in the sense that it was a group of people around a kitchen table that discussed the idea and got it started. So it originates directly from the community because of the need.
I've heard from various governments, didn't matter who was in at the time, that the wave of the future is community health centers where people can go and you can receive, a diverse amount of healthcare providers who can meet your needs. We heard that forever, but the money did not reflect that. The funding did not reflect that.
once I began to become familiar with the community, I realized the inequity in access to medical care and inequity across the board. In medical school, we had not really had any exposure to racialized communities, not very much.
There needs to be more knowledge about what are the differences between Black people and the general population. What are some of the differences? What do we need to really zero in on and target as health priorities, in that community?
We had a very interesting executive director with vision, Johanna Osterveld, who had the sense that we needed to broaden our way of providing treatment. And so during her tenure there, a social worker was hired. And the presence of the social worker made a huge difference.
Collaboration happens in many different ways. It begins, I think, with a way of collaborating with the patients that we see. And that's really important, It may seem obvious, but in fact, how you work with someone really defines how that relationship can go and how much assistance you can provide. So one of the basic tenets of the way that we deal with patients is that we accept where they are in their lives. We accept the decisions they make about their health care, even though we might understand them to be not in their best interest. We can't reasonably ask people to change in the context of chaos or in the context of impoverishment or in the context of an active addiction. We try to help people to change, but it's not always possible. So I think it's really a critical part of how we practice is we accept where people are and the decisions they make, and then we provide whatever care we can to maximize their health. So that's really what harm reduction is.
I hope the impact has been to make people understand that they deserve to have equitable medical care, that they have received it. I think that they have. And the other thing is the community has a voice, in how things are done and some of the issues that are approached. So I think all of that has been really important.
I'd love to see more preventative health care. That's one of the things also that the North End Community Health Center left an impact on me about just how important it is let's do prevention. Let's be preventative. See what we can do to stop this thing from growing. I still run into people today that said, that program changed my life.
All right, that's very inspiring to see today, to see the heroes who started what's become such a powerful force in our community. So thank you again. How about we take this moment to have a round of applause for Marie-France and the team, the folks who work at the center. At the city, through COVID and through the issues of housing, we've worked very closely with MF in the last little while, and she is a passionate advocate, as are the people that work at that organization, and great partners. I also want to recognize our friends here at the Westin. There's more meat coming if you didn't get enough on the plate. They tried to make sure everybody got a pound of meat on their plate. It was a good breakfast. So to the Westin, as we start to come out of COVID, is hosting events, and so nice to see them. So what a story that is, and what a great organization this is. Before we move on to hearing about how the organization has grown from those early days to a community health center that employs over 70 people and provides everything from primary care to housing to outreach programming. When I was asked by MF and by Ken Power, I think it was, to be here this morning, I said I'd love to do it. But I asked for one favor, to which MF immediately said, sure thing, which is I want to recognize those three heroes, but there's one in particular I've come to know. Does anybody in the room know Margaret Casey? Has anybody ever seen or met or heard of Margaret Casey? I don't know where you would begin to describe the force that is Margaret Casey. In addition to being a pioneer in collaborative community health, who's dedicated 25 years to practice at the North End Community Health Center, she's also found so many other ways to contribute for people who need her, volunteering with the United Way, the Community Foundation of Nova Scotia, Brunswick Street Mission, Seniors Advisory Council, and she will be a senior sometime soon, and other community organizations. This is all part and parcel of Dr. Casey's commitment to giving back. Along the way, she became Director of Admissions at Dow Medical School. I didn't know that. Is that true? Yeah. Helping countless people achieve their medical degree. She continued to support access to medical care by volunteering with international medical graduates seeking to practice here in Nova Scotia. And I just like her a lot. I see her at lots of different places, and you all see her. And when I think about her, there's an old adage that I made up, which is that the strongest voice is not always the loudest voice. And I think in Dr. Casey's case, that is so true. So I'm going to ask her if she would just come up. I just want to present her with a little certificate and also give her a small token of appreciation. I'll just read it. It says, to Dr. Margaret Casey for her career as a champion in healthcare dedication to the North End Community Health Center. Dr. Casey is an outstanding advocate to vulnerable members of our community, including seniors, and in ensuring that their voices are heard. She is one of Halifax's greatest citizens and one of the mayor's favorites. Thank you for your devoted leadership and commitment to uplifting our community. Just a small token of appreciation. So good to see you. Thank you very much. So, of course, thank you to Dr. Casey and as well Dr. Fraser, Rose, and all those who've dedicated themselves. That's such a great story, and has made such a difference in this community. And as somebody who had a father who did some pioneering in the medical field as well in certain communities, I just really admire the hell out of what you've done. Okay, now we're going to move. We're going to transition from some of our health heroes of yesterday. We're going to move to the health heroes of today, and certainly to the future. We got some folks here today that are going to be awesome. So to join me to share what is happening at the North End Community Health Center, there are people who have some different roles, and we're going to ask them to come up. Now, just to make sure they're not nervous, there's no need to be nervous. You're among friends. It's all easy. But let's give them a round of applause as they come up. Francine Leach is a dental hygienist who runs the only free dental clinic east of Toronto. Francine, if you could take the seat. Cynthia Jordan is a counselor, one of the good counselors, not the elected ones, who is in charge of the Pause Mental Health Walk-In Clinic at the North End Community Health Center. Come on up. Ty Silver is the team lead of the Housing First program and works closely with the housing team to support all of the center's housing initiatives. Ty, come on up. Jack Atkinson is a nurse practitioner who has been with the Mobile Outreach Street Health Program, which you might know as MOSH, since its inception 12 years ago. Good morning. And we have one seat left for Dr. Justin Quedado, who is a full-time family physician providing primary care. Come on up. Welcome to you all. And now I'm going to be like Bill Maher or Jon Stewart, and I'm going to leave here, the camera's going to pan away, and then Eastlink's going to catch me over here. Good morning.
Good morning.
Can you hear? That's okay. Yeah, good to see all of you. Thank you for being with us today. I know the work you do is awesome. So I'm going to ask each of you a couple of questions to find out what you and your teams do, and perhaps we'll talk a little bit about how service has changed over the years. So I'll ask each of you that. Talk about what you do, what your teams do, and how the service has changed. We'll start perhaps with Justin.
Hello, everyone. Is the sound okay? I'm a quiet speaker, so yeah. Thank you for having us, and I'm the newest member of the primary healthcare team. On the bottom end of the totem pole, so I think that's why MF asked me to speak. So I guess, first of all, I'd like to say that I really enjoy being at the North End Community Health Center, and it's a really great experience. And I don't know if I need to explain exactly what primary care and family physicians do, but I'll do a little bit of that, I guess. So first of all, the team consists of physicians, nurse practitioners, nurses, and if we expand it a little bit, it includes the social work team and as well as the dietitians. And together we work to diagnose acute and chronic illnesses and treat them accordingly. And I think at our clinic we really try to focus on preventative health care and health promotion. Moreover, there was a role that Dr. Houston had filled for many years with our prenatal clinic, and that's actually been continued with Dr. Legros. So we still offer that. In terms of how things have changed over the last number of years, obviously this organization's been here for 50 years, and I've only been here for 2. So it's a bit hard to comment on the whole change from the beginning, but in the last few years, I can definitely say that there's been a lot of changes, a lot of transition, and maybe some, obviously there's been a number of high profile and important retirements. So we had Dr. Casey, Dr. Houston, and Rose Fraser all retire recently, and then there's the looming retire of Dr. Fraser as well, and Marilyn. So all these people have really dedicated decades of work to the clinic and built it to what it is. And they've acted as mentors, and I can say that I owe a lot to Dr. Fraser and Dr. Houston. I was actually a trainee for both of them 3 years ago, and then I joined the clinic 2 years ago. And then I guess in terms of how the clinic has expanded its role, we've started to offer or try to bring in more specialty services to the community. So we have gynecology clinics operating once a month, internal medicine clinics to help answer questions about more complex patients within our practice. And that's all operated from the building itself, so it makes it more accessible for a lot of our patients to access these services.
Thank you very much. Jack, do you remember the question? Tell us a bit about what you do and how things may have changed.
Depending on the day, I don't remember who I am, so we'll give it a whirl. I work for MOSH, Mobile Outreach Street Health, who was developed by the great Patty Melanson, and I have been working with them for a while. My role has changed from an RN to an NP over the time. Our mandate is to provide primary health care. Anything you get in a doctor's office that Justin does, we want to give it to you out in the community where you're at. And that we have a nice big van you've probably seen touring around. And so we meet people in shelters, in soup kitchens, in parking lots, behind their favorite tree, wherever they feel safe and they feel is a good spot to receive the kind of health care they need. The biggest thing that we try to do is limit our resources and deliver to people who can't access healthcare in the traditional sense that the healthcare system wants us to. So difficulty when you have mental health and addictions and maybe just your life has fallen apart and therefore your coping mechanisms and behaviors are just not on how they need to be, to wait in a waiting room or get to somewhere on time or prioritize your day for your health instead of your shelter or your food or your drug. We believe strongly that everyone should have health care, even folks who are using drugs or doing things that our regular society might deem inappropriate. And we do that with a huge focus on building trust and just providing love, for providing space to hear what they want and how they want to receive their health care. So how has it changed? A lot. We had a tiny little pop-up minivan at the start that our tall Rick crammed himself into on a camping chair. So in ways we have so much more space in our new van, but also our team has evolved and changed and learned so much about boundaries and about how to help people in the way that they need and how to control our want to help people in ways that we think is best for their health, like paying attention to their blood work or paying attention to what they're eating or something, instead of just doing what they need to do that day and prioritizing their health. That's it.
Thank you very much. Ty.
Hello. I work for the Housing First program, and we started about 6 or 7 years ago. And when we started, we had 4 intensive case managers, a nurse, and an occupational therapist. And the idea with the program is that there's no requirements of the clients to obtain housing. We house people, and then we work on everything else later, with the idea that once people are housed, they can get the sleep and the rest they need and not worry about survival, and can work on all the other things later. We help folks go to appointments, doctor's appointments, lawyer's appointments, help them attend court, obtain food, help them navigate relationships, and we help them to get housing and then maintain housing. Also, if they get evicted, we help them find housing again, and then if they get evicted, we help them find housing again.
And a few more times.
Yeah, and a few more times. We don't give up on them, like unfortunately society often does. The idea of our program is we never give up on our clients. We always believe in them, even if they don't believe in themselves. In the past, it was much easier to find housing for folks, and it was easier to find housing for folks when they're evicted. Now, unfortunately, we have issues finding people housing altogether, and it's been really, really hard to have people, want a home, and there's not much you can do. But with the help of some private landlords, we have been able to house folks, thankfully, in the last few years. That's been a major change, where we really need to rely on relationships with landlords that we have, because when you have a lineup of folks coming to a viewing at an affordable unit, unfortunately, folks choose the people with a job over the person on income assistance, the person who's dressed well over the person who hasn't had a shower in a week for many reasons. So that is a huge thing. And yeah, I think that's where I'll stop with that.
Listen, thank you very much. That is such an important message. Thank you for that, Ty. Cynthia.
Hi, I think actually I'm probably the newest member of the team here at the North End Community Health Center, but I'm not new to the North End Community Health Center. I am from the community of the North End, and I have been a patient at the clinic for many, many years. So I think at least 30 years as I was a young person living in the North End of Halifax. So in terms of the PAUSE program that I am currently ecstatic about leading, it's fairly new. However, mental health services is not necessarily new to the clinic within itself. Esther McGinnis has been a mental health nurse at the clinic for many, many years. Shout out to Esther. She's been a trailblazer in the community and the center in terms of mental health. However, how is PAUSE different? PAUSE is a walk-in clinic. You don't actually need an appointment to receive services through PAUSE. Started out as a pilot project 2 years ago, and currently it runs in the evenings from 5 to 9. So folks can call the 1-800 number and just simply say that they would like to speak with someone about anything ranging from I'm having stress with my family, relationships, I have anxiety, I'm experiencing depression, And even folks who suffer from chronic mental health conditions will call the line for check-ins once in a while to see, just to kind of touch base, and we do check-ins with them and ask them questions around, like, are you taking your medications regularly? There was one client myself that I would check in with, because I could probably back up. I was actually on the pause line for a number of months while Megan was the team lead. And so I would check in with clients on a regular basis on Tuesday and Thursday evenings. So it was really, really fulfilling for me to do that work in addition to my previous employment. I really believe in the PAUSE program to be able to have accessible mental health services for anyone. You don't have to be connected as a client to the North End Community Health Center. Anyone within HRM can call. And actually, I've had folks that called outside of HRM who have seen our Facebook page, and we never turn anyone away. So currently we have one social worker who answers to the calls, and myself, and we have some admin support. So I guess I'll talk later in terms of how we like to see it grow. Right now we're looking at how we can expand to Dartmouth and to other surrounding areas for the in-person walk-in clinic and for telephone services as well. Thank you.
Thank you very much, Cynthia. That was a little teaser as to what's coming next. Thank you for that. Francine.
Good morning, everyone. My name is Francine, and I'm the dental hygienist in the dental clinic at the North End Community Health Center. In the past, our dental clinic was started and run by Dalhousie Dentistry, the faculty and student, the faculty and students, and it has ebbed and flowed over the past 30 years based on funding, because oral health is not one of our publicly funded programs in Nova Scotia. Oral health is very important to a client's overall health. And since I have been there in about 3 years now, the clinic has grown exponentially, thanks in part to our amazing partnership with Dalhousie and funding that we were able to access through our partnership there at Dalhousie. When I first started, we were working 1 day a week with dentistry and 1 day a week providing hygiene services with the students. And now we are running 5 days a week and providing care to not only clients of the North End Community Health Center, but also to everyone in our community who is in need of dental care. And so clients can access care by calling themselves, by having their healthcare provider recommend that they go, or through one of our MOSH team members. We often have referrals through them, and even our partners in the community, like Direction 180 and Salvation Army, and many of the other shelters will call on behalf of clients to get them in. So originally it was very urgent care based and getting people out of pain, and then a little bit of preventive care on the side there with the hygiene students. And now we've really shifted our focus to not only providing care for those who have issues that are needing to be addressed, like infections or toothaches, but we also are able to invite our clients back to become a regular patient and have preventive care. And we've also expanded to be able to see children in the clinic, which was an initiative that actually was part of the reason why I was brought onto the team. And so an interesting story is that many, many years ago, there was a couple of dentists volunteering on Saturday mornings, and their son, Jordan, who's sitting over at the dentistry table, was volunteering alongside them. And so we've come full circle now. Dr. Bonang is now our Wednesday dentist that comes in and helps support the students. And so he's gone from volunteer in the clinic to a student in the clinic to now being one of our instructors and really helping to provide the care that we want to provide for our clients. So.
Thank you very much, Francine. And is Jordan here? Where's Jordan? Stand up, Jordan, stand up. There you go. All right. Thank you all. That's really awesome. Now we're going to move to a couple of very specific questions to each person individually based on your background and the work that you do. We'll start with Jack. What are you watching on Netflix these days? No, not just kidding. That's just my own interest, but you can answer it if you want. No, Jack, how would you describe the community that you serve on Outreach?
Oh, diverse. I think it's a population of people who at sometimes feel ignored and have lots of mistrust of the healthcare system and our society in general. It's a population that is really on the brink of kind of despair and disaster, living in absolute chaos and in crisis, feeling in that fight or flight all the time. And when you're in that space, it's really hard to focus, and you choose different ways to behave and different ways to exist than you normally would. There's lots more outbursts, which is not based on who they are, but based on their situation, that you need to navigate. And if those outbursts happened in a traditional setting, like a waiting room of the hospital, they would be kicked out or not allowed back. It's a population that needs a lot of love and a lot of commitment to their health and their overall well-being, and just time. It takes time to build these relationships and to allow someone to come down from here to a space where they can have a conversation about what might be best for them in that moment. It's a population that is always changing. It's a transient group that comes in and out of that stage of being able to function at a level in our society. And above all, it's a population that really feels left out and alone and not cared for. And yeah.
Thank you very much. Justin, the work that you do, how is the work that you do different than the kind of work that a family doctor would do in a family practice?
Yeah, so I think it starts with how just like the clinic itself is different. As we learned from that video, the clinic was started by pioneers and community members and physicians who recognized the need in the community, where there was a marginalized population living in the North End, where healthcare was not accessible. And I think that it was ahead of its time in prioritizing, like looking at social determinants of health, looking at cultural background and how that plays into health overall. And I think that's finally something that's being like looked at more in the medical community, and its impact is starting to be more understood as a whole. But this group was doing it 50 years ago, so that's really amazing. I think it continues to be the backbone of how we provide our service, I hope. And then in regards to the clinic itself, I think the biggest part of how this clinic is different than other clinics is its collaborative attitude is much more than what I've seen in other places. Like, it's really great to be able to work on a team with other like senior physicians, nurse practitioners, a lot of people that you can learn from. And I think that I'm really thankful to have everybody on the team, like all the nurses, all the front desk staff, all the administrative people, and everybody here.
Occupational health.
And occupational health. And I think even though we all have different roles, we're all, there's like a team spirit in the group, and you can really feel that we're all working towards the same goal. In terms of like things among the patient or among the providers, I think is different. I think there's like a really one common thing that we all have as providers at the community center is really a desire to like learn and understand from your patients and taking the time to listen to them and to collaborate with them on their own healthcare. And then furthermore, like the patient population we see is really different from other practices I've been a part of, and like you look at cultural backgrounds and like ethnic backgrounds, and we see a lot of people from like the African Nova Scotian community, Indigenous community, trans community, and I think like learning from all those people and really trying to understand others so that you can provide better healthcare is a big part of what we do. And yeah, I think I just really enjoyed my time being there and to be able to be a part of that.
Thank you very much. Cynthia, let's follow up what you sort of mentioned earlier, that about PAWS being a great example of a unique way to provide better mental health supports in the community. What are the other things that you think should be done?
Well, I think that, in terms of mental health, I think that services should be able to expand to include more long-term programs that would be available for individuals who struggle with chronic mental health issues, folks that could utilize some education and support and therapy for mental health issues. Within the community setting. I think that would be essentially important in terms of increasing the wellness within our community as a whole.
Thank you very much. Ty, let's talk about affordable housing, which is such a big issue in the province and certainly in this city. So the centre is moving more into transitional supportive housing. Can you talk a little bit about that?
I can. So as I mentioned earlier, it's really hard to find housing in Halifax, so we had to adapt to that. So we have evolved to having places such as the hostel on Barrington Street, like MF mentioned. So we have a bunch of folks in there where we have a housing support worker who support them, and they also have, like all of our folks, the support of the North End Community Health Center and all that it offers. We also have a place on Bright Street, which is evolving in terms of the supports that we provide folks. And we have the place on Maitland that hopefully we'll have up and running in the new year that will support Black folks in the community, around 11 folks, and it will have support for them, and the idea is that they'll have a lot of wraparound community supports. And then the thing we're not supposed to talk about, which is a travel lodge, will be opening sometime in the new year, hopefully sooner than later, which is going to be huge. It's going to provide folks who are the highest acuity, who are often forgotten in our society, all of the needs, all of the support they could possibly need. Anything you can think of in terms of harm reduction, it will be provided. I won't go into details of what it will involve, but it will be groundbreaking within Canada. So those are some things that are happening. Hopefully there'll be more because the need is definitely there.
Right on. I found it interesting that while MF was keeping that a secret, there was a picture of the travel lodge on the screen. No, she's trying to be the good leader and keep everything quiet. I do want to just say about that, though, that to me, one of the most promising things about that is that all orders of government, AHANS, the North, all the community providers coming together on that one, which is what we need to do on housing and so many other issues. Francine, you talked about dentistry. It's been part of the clinic for 30-some years. How do you see that continuing to grow, perhaps, in the years to come?
Yeah, dentistry has ebbed and flowed, and so right now we're at an all-time high of providing dentistry care for our clients and those in the community. I see it growing to offering on-site dental care at some of our other locations. I see it growing to more partnerships with our educators here in Halifax, with Dalhousie University and Nova Scotia Community College. I see it as outreach as well, as actually just going into the community and maybe tagging along. Can I come with the MOSH van? Can I come along? Tagging along to some of the sites that we're visiting already and providing some education and an introduction and an invitation to the clinic to have the care there. It's all about building the relationships with our clients and with our partners too.
That's awesome. Okay, I got one last question. It's going to go to all of you. We can consider this sort of the short snapper round if you want, although I'm not going to buzz you out. But I want you all to close your eyes on the panel here. Close your eyes. Okay, it's 10 years from now. We're celebrating the Centre's 60th anniversary. What does it look like? How would you like to see it have changed from today? I will start on this end with you.
I see it growing. I see it getting bigger and better, and more access to care, and a model or an example to other community health centers across Canada.
Indeed, absolutely.
I see a new location that would not look like necessarily the building that we're in, but more accessible in terms of to the community, within the community. I also see services that are expanded in providing services to diverse, even diverse communities, more services to the diverse community that we serve now. More services for members of the African Nova Scotian community, more services for the Indigenous community, and for those who are less home. You know, I hope at that point in time in 10 years, we are certainly not seeing the level of homelessness that we are seeing within our community today. So I hope that is certainly part of the vision, that we have a huge impact in providing increased services for vulnerable populations.
Thank you very much. Time.
Do I get a prize for answering?
You do, yeah, of course.
Okay, great. Well, in terms of housing, hopefully we'll have more funding to be able to have more sites within the community where we can put folks. And hopefully we'll have more funding to have more staff. And yeah, just more options for housing folks, essentially.
All right, yes, you get a prize. Free cable for a year. Just see Lee Bragg over here, and you can, he'll take care of you.
Can I go again?
Jack.
I'm on for the Wi-Fi.
All right.
So I think about this a lot, especially recently with such a wave of integral members leaving our organization. And so I think, in my mind, in 10 years, I really hope that we're able to carry with us those essential values that were started at the table, that we're able to pull through. It's very difficult in this new, fast-paced, immediacy-based society with lots of contending issues to maintain the focus of what we were trying to do in the first place, to continue to give humane, equal care, and that seems simple, but it's not. So I hope that we can, in 10 years, still be hearing those voices of Dr. Casey and Dr. Fraser and Marilyn and Esther and those people who were such a pulse of our organization for a long time, and that we can still be providing care that speaks to those values.
Awesome. Duncan.
I think what I want to see the clinic become is whatever the community needs at the time. So I think
I should have said that. You're making me look bad.
Oh, it's all good. I think one of the major strengths that the North End Centre has is that we are cognizant of the needs of the community, and we're willing to talk with community members and find out what we need 10 years from now. So that's a cop-out answer. I'm saying I don't know. Whatever we need it to become will become.
No,
and brilliant. I think, personally, I'd like to see us try to really emphasize accessibility. So looking at trying to expand our reach to other areas where marginalized people go. And it's not just North End Halifax. So trying to operate in other communities and provide easy access to care for people so they could see a primary care provider or mental health services or dietitian, any of that.
All right. Listen, we heard earlier about the early heroes of the center. We remember people like Patty, who did such amazing work. And these are the folks today that are delivering these services that are so needed in the community. Ladies and gentlemen, this is your panel, today's Health Heroes. Thank you all very much.